Hi everyone, my name is Dr. Marwa Kaisey. I'm a board certified neurologist and MS specialist, and I practice at Cedars-Sinai in Los Angeles. Today I'm going to tell you the number one piece of advice that I give to my patients with MS that I know they're going to ignore. I take care of hundreds of people right now. I've probably taken care of thousands of people with MS, and especially the people who are new, who I've just diagnosed or who are new to the MS world. I tell just about every last one of them this if I can remember to. And I tell them this knowing they're going to ignore it. What do I tell them? I tell them, do not Google. Do not go home and get on Google. Here are the references that I can give you because I know you're going to want to learn more about MS. I know you're going to want to read more after we leave here, this appointment. But Google is not your friend. There's a lot of scary stuff out there on Google for medicine in general, but especially with MS because the MS landscape has changed dramatically in the last even 5 years. But I mean, 25, 30 years ago, there were 0 MS medications. Now there are over 24, and some of my favorites have come out just in the last 5 years. And what does this mean? This means that the disease does not look the way it used to, right? The more lately you've been diagnosed, the more recently our diagnostic tools are better. We're able to diagnose it earlier, we're able to catch it earlier, and we're able to treat it more effectively. And that means that the prognosis has changed dramatically, right? So you get on Google and you're getting stories from people who are diagnosed at different times, treated in different ways, not necessarily relevant to you. And like all things on the internet, the most extreme examples are the ones that are going to get the most attention. So anyway, Google is not your friend, but I completely understand the reaction of, well, I want to know more. I want to learn more. I would feel more comfortable and at peace if I knew more about what I was up against, if I had more information on treatments or prognosis. What even is this? We try to go over answers to all these questions, but at best, I have 45 to 60 minutes with somebody, and that is a time that we have to talk about all the symptoms they've ever experienced, do a physical exam, look at all their MRIs, look at all the lab tests they've had done and other studies they've had done, decide whether they have MS at all, give them that diagnosis, be with them through that difficult moment, explain how we came to the diagnosis, talk about next steps for how we're going to start thinking about treatment, the tests we have to do, the next appointments. It is so overwhelming, and I'm not even sure how much of that the person hears, right? Most of us, when we get big news or bad news, we stop listening, right? It goes one ear and out the other. I have to tell them all these things, but again, I don't know how much of it they can actually retain because we're all human, and if there's any, portion of it that's shocking or sad, as this news tends to be, right? I don't know how much of it they hear, so very limited time with a doctor, very limited ability to take in a lot of detailed, nuanced, new information in that initial visit. So of course you're going to go home and Google and try to read on the internet. I would do that if I were in their shoes, right? Totally understandable. But the resources out there aren't fantastic in that there are some good places to read, there are bad places to read. It's hard to know what's what, it's hard to know what's reliable. The good places to read, some of my favorites are the National MS Society has a wonderful website with vetted, accurate information that they keep pretty up to date. But it's a website, right? You can't go through it from start to finish. It's disjointed. You have to know what you're looking for, and it can get overwhelming. Another resource is my Instagram, this new YouTube channel too. I try my best to, but again, those are kind of disjointed ways, and I'm talking about some advanced things like did the COVID vaccine work and things that are kind of later down the line. So I wanted to create a resource for people who are in that very difficult time of being newly diagnosed. For them, for anyone who loves them and cares about them and wants to learn more about this disease. So I've targeted it to people who are newly diagnosed, but it's really for anybody who wants to know more about MS. And this is an online course called Conquer MS. I'm putting the details in the description for this video. You can find it, check it out, see if it's for you. Again, this is something that's near and dear to my heart because I see people struggle looking for information like this almost every day in my clinic. And I'm so happy to be able to try to fill that void, even for a few people. If I can do it for a few people and I can make their lives a little bit easier and I can make those first few months after a diagnosis a little less anxiety inducing, I will be so, so grateful. So take a look, see if it's for you. Only people it's really not for are other MS specialists, I guess, because they probably know everything that's in there. But if that's not you, if you want to learn more about MS, if you really want to get your mind around what the risk factors are for MS, who gets it, why they get it, what the diagnosis entails, how often we get it wrong and why the diagnosis might be wrong, what the treatments are, from treatments for acute relapses, what does even an acute relapse mean, disease modifying therapies, how can we fight back, right? And who might be a good fit for which treatment, symptomatic therapy, so what even are the most common symptoms of MS, how do we treat them, and then lifestyle questions. I get these a lot, even in that very first visit when I tell someone they have MS. Some of their first questions are like, well, what can I do to make it better? What can I eat to make it better? What exercises should I be doing? Oh, there's like a weird light here. Just distracted me. So all of that is going to be included in this course and more. And the whole point is to take you from a place of, I know a little bit about this. I may have a basic understanding. I have a lot of fear around the future. And to take you from that place to a place where you can say, okay, I still have some apprehension about the unknown. We don't have a crystal ball. This is my brain we're talking about, my spinal cord. But I have the confidence to know that I have the building blocks of the basics of the information about this disease. And I have the confidence to know that I can walk into my doctor's office and ask the right questions and really probe them as to why they're doing this, why we're not doing that, and to feel in control of having MS, right? That's what this course is really intended to give people, is a sense of control and hopefully a little bit of a sense of peace and a little less anxiety, because MS is a very anxiety-inducing disease, even down to how it actually changes our brain structure. So that is who the course is for. That's what's in it. I hope you guys check it out and that some of you find it useful and that you sign up. Thanks all.